Look at your latest numbers now. South Africa has recorded 967 new COVID-19 infections in the latest 24-hour recorded cycle. This is the lowest daily tally registered in months, and there's been a sustained decrease in cases across the provinces in the last 2 weeks, with confirmed cases now remaining below 5,000 per day. Nevertheless, people continue to lose their lives to the disease, with 51 more deaths now being reported in the past day or so. Now, South Africa has administered under 30,000 COVID-19 vaccines over the last 24-hour reporting period. This is a far cry from the 300,000 target of daily shots needed to vaccinate 70% of the population by mid-December. To talk to us about this, we're joined by Virologist Schoub, University of Natal Dean of School of Nursing and Public Health, Mosa Moshabela. And good evening, gentlemen. Thank you very much for your time and joining us tonight here on In Focus. Let me start with your tweet, Prof. You're saying the monstrous third wave comes to an end, although we don't yet know what the next few months have in store for us. We can at least draw comfort in knowing we have overcome Delta and the third wave. Tribute to everyone who played a role, big or small, in bringing us to this point. There is celebration, but a little bit of caution, particularly around what is coming up next. Am I correct?
Absolutely. Good evening to you, Tawe, and to Barry, and the viewers as well. No, absolutely. I think that, I extend my gratitude to all South Africans for having faced such a monstrous task in front of us and challenge in front of us. And of course, during the process, we've lost a lot of loved ones, people we care about, and many we knew, many we didn't know, but nevertheless, there's been a lot of loss, a lot of death, and a lot of families and friends and colleagues have lost loved ones. But also, I think, in spite of all of that, all of the losses that we've seen, we've also seen a lot of people come, rally around, the fight against Delta and the third wave, and do whatever they can, even if it meant to, put on a mask or to stay home, or in case of our healthcare workers, in terms of being in the front lines and so forth. And so, we have to extend our gratitude. At the same time, pass our condolences to the families who've lost their loved ones.
Professor Schoub, how did we overcome Delta and the third wave?
Yeah, good evening. Professor Moshabela, good evening, everybody. Yeah, look, I don't think Delta's disappeared. I think these infections come in waves. And we've seen it in the first wave, the second wave, the third wave. They come in a cyclical periodicity. They last for about 75 or 76 days, and there's an interval between them of about 96, 95, 96, maybe 100 days. So they come in waves, and the reason for that is that there's a build-up of the virus in the community. There's a natural immunity from people that are infected, supplemented by the vaccination, and then, of course, it goes down, it reduces, but doesn't disappear completely. And then periodically there's a build-up of the amount of virus in the community, and so we have the next wave. So it's great news. Certainly the infection rate has come down quite dramatically. The number of cases come down, and very gratifyingly, the cases that are hospitalized has come down quite markedly. As I think it's been quite widely reported in the media, the data from the Western Cape, where the percentage of individuals that were admitted to high care or intensive care, or people that have died, only a small minority, saying like 4 to 5%, were people that were vaccinated. So certainly the vaccine has had quite a dramatic effect in reducing, even now with the amount of vaccination that we've achieved, the serious disease. However, the virus is still with us. At the moment, it still is Delta. Delta is the predominant variant. There may well be different variants which in the course of time will arise. And we must expect that there will be a fourth wave. We hope that the fourth wave is not going to be as severe as the previous ones, because there's been quite a build-up of immunity from natural infection and supplemented by vaccination. But unfortunately, at the moment, we can't go back to our pre-COVID era existence. We still have to have all those precautions because the virus is there. We don't want to kind of build up the amount of virus in the community, which will then result in the fourth wave. So this is where we are at the moment. We're in a good space at the moment, and we're trying to get as many people as vaccinated as soon as possible. Clearly, that's our biggest priority, and we still need to kind of keep up with all those infection prevention procedures. Unfortunately, we can't at this stage let go of that, the mask wearing and the socializing and the distancing, etc., etc.
17 million and counting doses that have been administered so far. Is that a good number, Professor Moshabela?
I think in terms of doses, it is a good number for South Africa, given the fact that we really only started in the middle of May to formally launch the vaccination rollout for the general public in the country. So we've made strides in many respects. We have come as far as opening for all adults above 18. And so it's been tremendous progress. More than 12 million people vaccinated out of the targeted 40 million, which is 21% at the moment, 1 in 5. So it's a lot of progress. We have to also acknowledge that it's not where we would like to be. We still have a long way, and we are dealing with a lot of, some degree of hesitancy in the population for different age groups. But as we all know, the country aims to be at about 70% of the adult population by December. So 20%, 21% is good, but we still have a long way to go.
Saturday saw the lowest number of new doses, 26,000. When we peaked at some point around the 10th or the 11th of September, we hit that all-important almost 500,000 mark of new doses. If you look at that kind of difference, 500,000, and yesterday we went down to 26,000. It slightly went up again today. I think they're saying 117,000 that they are counting now. Are you making much of that particular skip?
I think for me, I'm not too concerned. In general, I think this whole past week, we saw numbers on Monday going to around 150-something thousand doses administered, and really kind of averaging around 180,000 for the rest of the week. It's a long weekend. There is something about holidays in terms of health services where, in general, the demand for what we regard as health services tend to decline during weekends, during holidays, especially in the way that we've designed our rollout. I would not necessarily use this long weekend to judge the whole vaccination program. I think that we should pay close attention to the fact that we've dipped below 200,000 on daily basis. But otherwise, I do think that it is also caution for everyone concerned to not necessarily neglect the vaccination rollout, especially as the political leaders start to concentrate on electioneering. And many of them, of course, they are, leaders in many respects in society. We should not neglect vaccination rollout in the process. And this coming week will tell us a little bit more about where the trends are going. At the moment, dipping below 200,000 will not necessarily get us to 50% by end of November. And if we don't get to 50% by end of November, then we're not going to come near the target that we're aiming for. We may not even be able to reap the rewards that we could reap from vaccination whenever the fourth wave hits us. So I would say that it is imperative that we do everything we can to keep those daily averages above 200,000. Even if we don't hit 300,000, it's okay, but above 200,000 on daily basis, so that we get at least 1 million doses a week.
Yeah. Professor Schoub, what were we doing when we hit 484,000? I mean, that was perfect. I think there's something right that we were doing around September the 10th when we were able to hit those numbers.
Yeah, you see, I think when there's the start of the campaign and there was a quite a lot of publicity and positive publicity. People were eager to get vaccinated. I think with that kind of initial enthusiasm to get vaccinated, I think we will hit those targets. The problem, of course, is that there's always some degree of you see, I think there are two things which we need to kind of address in terms of getting people to the vaccination sites. One of them is the issue of apathy. People, initially, there's a lot of enthusiasm, but after a while, there's some degree of apathy. People, I think, have a feeling, well, they couldn't be bothered. In some cases, it's a problem of transport, of getting to vaccination sites. And then the accessibility of getting to vaccination sites. I think a bigger problem in terms of magnitude is vaccine hesitancy. And we're seeing that quite marked, in fact, throughout the country and in different populations as well, that people are justifiably to some extent asking questions. They're anxious, they're nervous. It's a new vaccine. We've never had this kind of mass rollout of adult vaccination. It's always been pediatric vaccination, childhood vaccination. So it's a novelty, and clearly people are asking those questions. And really it's up to us, the professionals, with respect up to you, the media, to kind of communicate to the population. And we also need what we call trusted communicators, people that are trusted by the community to kind of communicate the message of getting vaccinated, that it is very, very safe and very effective. And that's really the kind of only weapon that we do have to bring this pandemic or epidemic under control.
We continue with Professor Barry Schoub, Professor Mosa Moshabela when we continue next. And we ask the question, what will the department need to be doing between now and December to at least not see us back in a lockdown type of situation, should indeed the fourth wave hit around the December period. Do stay with us. We'll continue in a moment. Welcome back. You're live with us tonight on In Focus, Newzroom Afrika, Channel 405. Professor Barry Schoub as well as Professor Mosa Moshabela with us. And we're, of course, looking at the number of vaccine doses administered in the last 24 to 48 hours, and some concerns as far as the drop is concerned. But with a potential fourth wave around the corner, what should the department be focusing on right now? Professor Schoub, you're saying that these outbreaks happen in periods of about 100 days. So if you count maybe at least 90 to 100 days from now will be around the December period. Can we avoid a lockdown with the fourth wave possibly coming around that time?
Yeah, I hope you can avoid a lockdown. I think that's lockdown carries with it quite a kind of severe message. We're talking about the level 5 lockdown we had in the first wave. I hope we won't get to that stage at all. How severe, and of course, when I say that periodicity, it's not to say that it definitely will. I think this is what's happened up to now. We're not quite sure what actually determines this precise periodicity, but I think we can be reasonably confident to expect a fourth wave around the end of the year. What we can do to ameliorate it, I think there are really three things which govern the severity. One is the level of vaccine coverage. We need to push up the vaccine coverage to get as many people vaccinated as soon as possible. That's the one thing. The other thing is that there has been quite extensive natural immunity in our population. Various what we call seroprevalence studies, where they look for the prevalence of antibodies in samples of blood, that shows us that anything from 40 to, in some cases, even 30% of the population have been exposed already, and that will give some degree of immunity. And then lastly and importantly is human behavior, that we still, as I mentioned before, will still need to rely on human behavior to augment that immunity given by the vaccine and given by natural immunity. And if we, as assiduous as we are in getting human behavior implemented, that will kind of certainly ameliorate, will reduce the effect of the fourth wave. I think we can be reasonably optimistic because of the extent of natural immunity, of vaccine coverage, that the fourth wave will be not quite as severe as the third wave, which was certainly a longer duration than the second and the first wave. So what we can do, in fact, is boost up our vaccine coverage, getting vaccine out to the community, either with mobile vaccination or getting vaccine out to businesses, to industries, and so on. So accessibility is facilitated. Promoting good behavior, that would certainly then ameliorate, reduce the severity of the fourth wave. And hopefully we can succeed as much as possible in getting those parameters going.
Prof. Moshabela, 21% of adults fully vaccinated. So that leaves a huge number of adults who are not vaccinated, who will probably be participating in the voting come November 1st. How do we promote good behavior?
Yeah, no, it's a very important question. And I think that what we forget is that when we are promoting uptake of vaccination and the need to promote vaccine uptake during this period requires innovation. It requires innovative approaches. It's not something that you just dream up and do if you're going to vaccinate with Johnson & Johnson at pension pay points. It's not something that you just dream up to go and take vaccination into communities with community health workers. It's a lot of innovation because these are not things that we do routinely. But also, you know, if the vaccination program understands that it continuously needs to innovate in order to accommodate different people with different interests and needs at different times, then, you know, it creates a good foundation for an agile program that is adaptable, that is able to accommodate opportunities that may arise at any given point in time. Personally, I think that it would be a major mixed opportunity not to link vaccination to the electioneering process building up to the 1st of November. Because if the message around electioneering is completely divorced from vaccination, the message around electioneering is going to dominate and drown out the message around vaccination. And this is already happening at the moment.